Hello, everyone. My name is Maduka, and today we'll be looking at a couple of issues around communicable disease epidemiology. Remember, the course is Principles of Epidemiology, and specifically, we'll be looking at communicable or infectious disease epidemiology. What are some of the concepts? Uh, what is when we use the word natural history? What are we talking about? What are we referring to? We'll learn that in another lesson. We'll also look at the epidemiological triad and other theories of disease causation. We'll learn that in another lesson. The fourth lesson will look at modes of transmission of infectious diseases. And then finally, we'll look at the principles of the control of infectious or communicable diseases. So it's important that we start off with an understanding of some of the concepts in communicable disease epidemiology. Let's look at some of the definitions of concepts and terms. So we have all of these that we will be defining quite a bit, but we should be able to get through it. Not so difficult. Many of these are terms you have heard, but you may not have really understood how it's used. So, what is a communicable disease? A communicable disease is an illness due to the presence of certain infectious agents or toxic products from that or those agents that are capable of being directly or indirectly transmitted from one person to the other, or from animals to man, which we call zoonosis, or from animal to animal, or from the environment, very important, through air, water, food, hands to man. So any agent capable of producing illness that is transmitted from one person to the other, directly or indirectly, would be uh, an agent that causes communicable disease. So bear this definition in mind. What then is an infection? So when they say, somebody has an infection, what does it mean exactly? It's the entry, development, or multiplication of an infectious agent in the body of man or animal. So while a communicable disease talks about um, any disease that is manifesting through, or any illness that is showing due to the transmission of a specific infectious agent or its toxic products directly or indirectly to man, or from animals to man, or animals to animals, or from the environment to man. So an infection is the entry, development, or multiplication of an infectious agent in the body of man or animals. Now, that someone is infected does not necessarily mean that there will be the manifestation of an illness. Many people have infectious agents enter into the body, develop, maybe multiply, but there is no apparent illness. And when we look at the natural history of disease in the next um, set of lectures, you would understand why that's one of the explanations, actually, why that is so. So there are several levels of infections. We call them the gradients of infection. The first one is colonization. The infectious agent gains entry into a susceptible host. We'll see the definition of a host later on. And then colonizes, takes over, starts to develop, starts to spread. At the point of colonization, it's not likely to be that there will be a manifestation of ill health or signs and symptoms. Now, further down the line, you have subclinical or inapparent infection. So subclinical means that you do not clearly have obvious signs and symptoms manifesting, but there's already damage at tissue and at organ level in the body. So while the body is still trying to contain it, there are certain telltale signs that come up when certain investigations are done. That is how we identify someone is a subclinical stage or inapparent infection. Then there's what we call latent infection. Now, latency just talks about that time period between when the infectious agent gains entry to when you have onset of signs and symptoms, and then it can go back into a quiet mode again, and then you now have another flare of signs and symptoms, as is typical for the virus herpes simplex. And then, of course, clinical infection. That's the one that presents with signs and symptoms, and actually is the first time an individual is alerted to the fact that he or she has an infectious disease. So there is also a terminology known as contamination. And contamination is the presence of an infectious agent on a body surface, on clothes, beddings, toys, surgical equipment, instruments, dressings, other articles, including water and food. So water can be contaminated, food can be contaminated. Just being present. The difference between a contamination and an infection is that in the contamination, the infectious agent is present. In infection, the infectious agent gains entry into a susceptible host, and it's able to develop and multiply from there. So there's also a special category called infestation. Usually infestation is usually reserved for the use of pests like parasites, like worms, like the hookworm, tapeworm, and then arthropods like lice, itch, malaria. So infestation is the lodgement, development, and reproduction majorly of arthropods or of parasites on the surface of the body or in the human gut, the gastrointestinal tract. Whenever you have an invasion of either a parasite or a parasitic, for example, parasitic worms or arthropods, you know you have an infestation. So you can have, someone can have lice on the hair, and that's an infestation. We will not call it an infection. So we've heard this term contagious. Contagious. What does it mean? It simply is a disease that is transmitted through contact, personal contact. For some reason, skin must touch or body fluids must be exchanged. So a contagious disease are all sexually transmitted infections that are transmitted through sexual intercourse are contagious as well. So a contagious disease is actually a subset of an infectious disease, and it's characterized by the presence of contact. So scabies, trachoma, leprosy are all tuberculosis. So contact. So as a host, so this is where we begin to define, although we'll look at it when we talk about the theories of disease causation, we'll look at it more definitely, in more details. But for now, just a definition for us. There is a person or an animal that affords subsistence or lodgement. So it provides a home, it provides a place of rest, it provides a place of development to an infectious agent under natural conditions. So if a human being is a host of, for example, the malaria parasite, what that means is that the human affords the lodgement, the entry of the parasite, the multiplication or development of that parasite, and so on and so forth. And so you have different categorizations of hosts. You have the obligate host, you have a primary host, or intermediate host, and just simply a transport host. Well, we'll look at host characteristics a little bit more later. Vector of infection. A disease vector is usually an insect or any living carrier that transports an infectious agent from an infected individual to a susceptible host. So it's either the infectious agent or the waste or toxins. Whenever you have a situation where a living carrier, usually it's either, most times it's their vectors are insects, and then vectors can also be things like rats, cockroaches, and so on and so forth. So it carries, transports, moves the infectious agent from the infected individual or from the wastes of to a susceptible host, or its food or immediate surroundings. So a vector must not necessarily move the agent into, break the skin barrier and move into the body. It may just be a contamination of food and water that someone eats and then causes the agent to gain entry into the body and multiply. Now you should also know that there are biological and mechanical vectors. And we would look at this, I believe, in quite some more detail as we get down in the lecture series. Now, this is also a very important definition that you must know and understand. Any person, animal, arthropod, plant, soil, anything at all, or a combination of it, in which an infectious agent normally lives and primarily depends on for survival, is a reservoir. So the infectious agent normally lives there, whether it be a human being or an animal or an arthropod, or to plant, or to non-living things all the way like soil, or a combination of this, in which the agent, infectious agent, normally lives and multiplies and depends primarily on for its survival. It produces itself in such a manner that it can be transmitted to a susceptible host. So that is a reservoir. That's a reservoir. So you've often heard the word case. A case is defined as a person in the population identified as having a particular disease, a health order, or the condition under investigation. The word endemic refers to the unusual occurrence of a specific health-related behavior. Unusual occurrence or occurrence of a health-related event in excess of what is expected. Endemic, constant presence of a disease or infectious agent within a specific geographical area or population group. Usual or expected frequency of a disease. So you say a disease is endemic, like malaria, for example, is endemic because the number of cases we see is what we expect. So one disease, a disease can be endemic in a particular region, an epidemic in another region. Notice, because the definition involves a given region, geographical area, or population group. A disease like Lassa fever, if we have one, two, three, four cases happening in a particular geographical location, we would say we have an epidemic. While 10, 15, 20 cases of malaria is still endemic. One case of COVID-19 or one case of Ebola is an epidemic, while it will take several cases of report of measles being reported to consider whether that is an epidemic. So the definition, specific cutoff range, number of cases from which you would transit from endemic to epidemic is different in different disease concerns. So you have this term, which is not so commonly used anymore, but it's good for you to know it, of hyperendemic and holoendemic. Hyper expresses that disease is constantly present in high incidence or prevalence rates and affects all age groups equally. While holoendemic, high level of infection that starts early in life, affecting most of the child population, with high prevalence. But as these people get older and get into adulthood, they reach a state of equilibrium, and then the disease is better tolerated. Is not occurs less commonly in adults than it does in children, and the manifestation is less severe in adults than it is in children. A typical example is malaria. So of course we know the word pandemic. It's an epidemic affecting a large proportion of the population, occurring over a wide geographical area. Occurring over a wide geographical area. That's a pandemic. So once a disease has crossed international borders and is affecting multiple countries, you are looking at affecting multiple countries with that large proportion of people in the population being affected. It's defined as a pandemic. So of course we know COVID-19 is pandemic. Ebola in 2014, 2013, 2014, 2015 was also pandemic. When we use the word exotic, we're talking about diseases that are imported into the country. And they didn't previously exist in that geographical area, so they are moved from that geographical area to the other. The word sporadic just means scattered about. It means the cases occur irregularly, haphazardly from time to time, generally infrequently. Cases are few and spread widely in time and place. You may not be able to see the pattern or connect the dots until you pay very close attention. Polio does this kind of thing, tetanus does this. And of course, you know that cases of sporadic manifestations of illness is a starting point of an epidemic. Carrier. Carrier states. So carrier state is an infected person or animal that harbors, excuse me. Carrier state is an infected person or animal that harbors a specific infectious agent in the absence of clinical signs and symptoms. So the person or animal has the infectious agent, harbors it, and is able to transmit it to another person. Is a source of infection to others. That is a carrier. So no obvious signs and symptoms, but it's transmitting the infectious agent from one person to the other. So there must be the presence of the disease agent in the host. There must be absence of recognizable signs and symptoms. And then it's the ability of shedding the disease agent. Um, so I'd mentioned zoonosis briefly before. Is an infection that is transmissible under natural conditions from animals to man, mostly vertebrate animals. Vertebrate animals. An epizootic is an epidemic of a disease in the animal population, while enzootic, just like epidemic and endemic, is a disease condition that is endemic, that occurs in frequencies and numbers that are expected. Nosocomial infection. Nosocomial infection, another name is hospital acquired. Is an infection originating in the patient while in a hospital or another healthcare facility. The definition is a new disorder unrelated to the patient's primary condition, which means that the patient did get it as a result of being admitted in the health facility. An opportunistic infection is an organism, infection by the reason of an organism that takes opportunity provided by a defect, a lowering, a drop in host defense or host immunity, and therefore is able to infect the host and cause disease. The thing about opportunistic infections is, the word is they're opportunistic. So before or prior to there being a defect or a reduction or a lowering of host immunity, you would not have the manifestation of an opportunistic infection. If host immunity were intact, there would not be an opportunistic infection. Opportunistic infection takes advantage of the fact that there is lowered or reduced immunity. That's what happens. So tuberculosis, for example, is an opportunistic infection, herpes simplex, and so on and so forth. So the word eradication in comparison with the word elimination, and this is important, termination of all transmission of infection by the extermination of the infectious agent. That's the infectious agent is completely wiped and eradicated through surveillance and containment. So it's an absolute term. It says none of the infectious agent at all, as in not one. And it also refers to the complete cessation or termination of a particular infection from around the world. On the other hand, elimination is something similar, but it happens in a specified geographical location. So, for example, polio has been eliminated in Nigeria, and we are waiting for the next steps of eradication of polio in the entire world, just like smallpox has been eradicated. Okay, so this is the much that we will take for this lesson. Thank you.